Okay, let's go.
Today, we're going to dive into something called Generalized Anxiety Disorder, or GAD for short. Now, it's a term a lot of us have probably heard thrown around, but what does it actually feel like to live with it? Let's get into it. Look, we all have things that keep us up at night, right? A big project at work, a tricky conversation we need to have, maybe our finances. Worrying is just, well, it's part of being human. But for some people, that worry isn't just a temporary visitor. It's more like an uninvited guest who moves in, puts their feet up on the furniture, and flat out refuses to leave.
So let's get right to the heart of it. Where's the line? What's the real difference between the everyday stress and anxiety that we all feel and an actual clinical diagnosis of GAD? Because trust me, the difference is huge.
So here's the official breakdown. And the words to really focus on here are excessive and uncontrollable. See, this isn't about having a bad week or a stressful month. We're talking about a constant nagging worry about a whole bunch of different things that's been going on pretty much every single day for at least 6 months. And this is where you can really see the difference. You know, everyday worry, it's usually about something specific and it eventually goes away. But the worry that comes with GAD is on a whole other level. It's intense, it sticks around forever, and it feels completely impossible to get a handle on. And here's the most critical part. It actually gets in the way of living your life. It's not just a feeling anymore, it's something that impairs you.
Okay, so keeping that distinction in mind, how does a doctor actually figure this out? How do they land on a diagnosis of GAD? Well, the criteria they use are really specific, and they paint a super clear picture of what this condition looks like.
It really all boils down to these 3 core features. First, you've got that excessive long-term worry we just talked about. Second, you find it incredibly difficult to manage or shut off that worry. And third, and this is a big one, the worry isn't just happening in your head. Nope, it shows up in your body with real physical symptoms. And that brings us to this number 3. For an adult to be diagnosed with GAD, they need to be experiencing at least 3 specific symptoms from a list of 6, on top of all that constant worrying we just mentioned. And hey, there's actually a pretty handy way to remember these 6 key symptoms, using the acronym you see right here, BSKIM. So let's break down what that BSKIM acronym actually means.
The B is for your mind going blank. You know that feeling when you're trying to concentrate and poof, your thoughts just vanish? That's what we're talking about. It's like the anxiety is taking up all the available space in your brain.
E stands for being easily fatigued. And it makes sense, right? Being in a state of constant worry it's exhausting, both mentally and physically. It's like you're running a marathon every single day, but you never, ever get to the finish line.
S is for sleep disturbance. This could mean you have trouble falling asleep, or you can't stay asleep, or maybe you wake up in the morning feeling like you haven't slept at all. Your mind just will not switch off.
Next up is K, and that's for feeling keyed up or totally on edge. It's this deep sense of restlessness, of never being able to truly relax, almost like you're constantly bracing yourself for something awful to happen.
The I stands for irritability. I mean, when you're perpetually on high alert and you're completely worn out, it's no wonder that your fuse can get incredibly short. It can lead to a lot more frustration and snapping at people around you. And finally, we have M for muscle tension. Chronic worry often makes people clench their muscles without even realizing it. This can lead to all sorts of persistent aches and pains, especially in your neck, shoulders, and back.
Okay, so we know what it is, but who does it affect? When we look at the data, we get some really important clues about who's most at risk.
Research shows that the chances of having GAD at some point in your life could be as high as 9%. Now, to put that into perspective, that means almost 1 out of every 10 people might go through this. That's a lot. And what's really fascinating here is that we see a big difference between men and women. The data clearly shows that women are diagnosed with generalized anxiety disorder 2 to 3 times more often than men are. So what puts someone at a higher risk? Well, it seems to be a mix of things. Part of it can be your temperament, things you're kind of born with, like being naturally more cautious or prone to negative feelings. But it's also about your environment. Things like having gone through tough experiences as a kid, or even having parents who are a bit too overprotective. Now, here's where things can get a little tricky for doctors. Because you see, worry shows up in a lot of different conditions. So it's absolutely crucial for them to figure out if it's really GAD or if something else is going on.
So take OCD, for example.
With GAD, the worries are usually tied to real-life stuff, your job, your money, your family's health. But with OCD, the anxiety comes from what are called obsessions. These are intrusive, unwanted, and often pretty irrational thoughts or images that just pop into your head.
And the difference with social anxiety is also super important. The worry in GAD is, well, it's generalized, it's broad, it's persistent, and it covers a ton of different life areas. The worry in social anxiety, though, is laser-focused on one specific thing: a deep fear of being judged, embarrassed, or just seen in a negative light by other people.
And that brings us to the most important part of all of this, really. GAD can be an incredibly tough thing to live with, but, and this is a big but, it is absolutely treatable. There are clear, proven pathways to getting better and managing it.
One of the absolute best treatments out there, and often the first thing doctors recommend, is a type of therapy called cognitive behavioral therapy, or CBT. It's all about learning how to spot, challenge, and ultimately change those unhelpful, anxious thought patterns and behaviors that keep the worry going.
So as we wrap this up, I want to leave you with a really interesting idea that's starting to shape how researchers think about this. Some experts are beginning to wonder, is GAD truly a single distinct disorder? Or is it maybe something more fundamental, like a personality trait, or a dimension of our temperament that can express itself in many different ways? It's a fascinating question, and it just goes to show how much we still have to learn.